Good morning, everyone. According to World Cancer Report, 1 in 10 Indians will develop cancer during their lifetime, and 1 in 15 Indians will die of cancer. WHO warned that global cancer rates could rise by 60% over the next 20 years unless cancer care is ramped up in low and middle income countries. Celebrating on February 4th, World Cancer Day is an international initiative uniting people across the globe to raise awareness and take action. This year is a reminder of the enduring power of cooperation and collective action. When we choose to come together, we can achieve what we all wish for: a healthier, brighter world without cancer. Together, all of our actions matter. Welcome to the latest episode of Wake Up to Health Talks. We have with us today Dr. Ashok K Vaid, a Padma Shri recipient for his stellar work in oncology. And today we talk to him about cancer and how can we overcome it together. Welcome, doctor. It's an honor to have you on this platform.
Thank you, Apurva. It's an honor and a privilege indeed to be a part of this program and to be disseminating the knowledge, information about cancer and the prevention of cancer. Thank you so much.
Thank you, sir. And as we move on, whenever we talk about cancer and whenever we hear stories about cancer, there are a lot of myths and misconceptions that come across, including that there is no cure or nothing can be done about cancer. And, ultimately, the final result is death. Can you elaborate on this? Is it really that dark?
See, there is a lot historical about all this. Mm-hmm. Cancer indeed is a difficult disease, even for the physicians who treat them. And historically, if we see, the real push towards the outcomes has happened in the last about 50 to 70 years. Mm-hmm. The results have gotten better. And there is a lot of, nihilism and negativity from the past, which is still overflowing into the current era. Mm-hmm. But if you look at the landscape today, the treatments have gotten better and they have actually improved the overall outcome for these patients. The cure rates have gotten better. Now, with the targeted and the biological entities, treatments stepping in, we are converting cancer into a chronic disease. And a lot of these medications today are oral pills, which people are taking, having a better quality of life, extension of life, and even leading to cures in many cases. So a lot of these oral drugs and medications are leading to the chronicity of the disease, and people are enjoying better quality of life, even extension of life, and leading to cures as well. So the overall myth that cancer is a incurable disease doesn't really hold good. Why it holds good in our perspective has been because majority of our patients have been coming in stage 3 and stage 4 stages, where the outcome of treatment drops. But look at the Western world, where the majority of the patients come in stage 1 and 2, and the cure rates are very high. In fact, in the US, today, the cumulative overall cure rate for the cancers has gotten to the point that where it is gone to about 60% and plus. So that goes to say that 100 cases diagnosed today with cancer in the US, we expect 2/3 of them to be getting cured forever. That is because these patients are coming early. There is access to screening, early detection, information, lifestyle changes. So many things have happened. These are yet to catch up. These are yet to happen in this part of the world. Therefore, this myth will persist for some time more, but the change is on the corner.
So there was a great point that you said that in Western countries, the rate of cancer deaths is reducing because people generally consult their physicians at a very early stage. So right. I wanted to understand there must be some signs and symptoms associated, with your health that you can understand and talk to your physician about, so that you can know whether you're in early stages of cancer or not. What are these early signs and symptoms one should look out for?
I think that's a very pertinent point, and that's an excellent point you have raised, because that is what leads to a suspicion in the mind of an individual living in this society.
Exactly.
So there are certain symptoms which individuals should not ignore. And if they persist beyond about a couple of weeks, they should go back to the doctor to check for the cause of that symptom. And it is, if there is a change in the voice, there is a hoarseness of voice, this could be linked to the cancer of the voice box and sometimes cancer of the lung. If there is a lump in the breast, and mind you, let this message be very loud and clear to all the listeners here, that all lumps in the breast are not cancerous. Majority of the lumps in the breast are going to be non-cancerous, but
Mm-hmm.
that you would get to know only if you go and check up with the doctor, not staying
True.
at home, not presuming. Initially, the lumps are going to be initially painless, and then they will grow over a period of time. And pain is a late manifestation of cancer. Pain is not an early manifestation of cancer.
Mm-hmm.
If there is a skin wart, or there is a mole which is getting bigger, is changing color, or there is a bleeding from that
Mm-hmm.
skin mole, go to the doctor. Any bleeding with the urine, with the stools, or in the urine, or for women who have attained menopause, there is a bleeding after menopause. I think these are all symptoms. Unexplained weight loss, unexplained fever, unexplained
Mm-hmm.
loss of appetite, blood in the cough or persistent cough. These are all warning signals. Mind you, again, it is not always that every cough and blood in the cough is cancer. It could be tuberculosis, it could be pneumonia, it could be other infections. But you would only detect cancer if you test. So, therefore, with a high index of suspicion, going to the doctor for checkup is something very, very important. Difficulty in swallowing, don't forget, could be a sign of the cancer of the food pipe. So these are the common symptoms which we should not ignore, and have a checkup as early as possible.
True, exactly. The points that you mentioned, the symptoms that you mentioned, these can be a sign of a lot of other diseases, but
True.
you should not ignore them because your physician and your doctor is the best judge of that. I think
Absolutely.
great point. And
Absolutely.
while we're talking about early symptoms and early signs, I wanted to understand: can these be prevented? Are there any lifestyle choices that we can make, and some precautions that we can take to avoid cancers altogether?
Excellent point. So if we look at the overall causes, and this is a question we are confronted with by most of the patients in the clinic as well. Doctor, what did I do wrong to get this disease?
Exactly.
Now, lifestyle plays a role in almost as high as 50 to 60% of patients. Now, this is
Mhm.
surprising. What
Exactly.
is the
I didn't know that.
what is the single most common cause for cancer? Tobacco. Whether you smoke it, you chew it, you sniff it, you do anything, there is no safe tobacco in this world. 40% of the cancers in the human body are linked to tobacco. So, therefore, out of the 100 cases coming to a clinic, 40 are preventable by just stopping to use tobacco. Is this not amazing?
This is
And look at the list of cancers which are associated with the tobacco: lip, tongue, cheek, cancer of the voice box, cancer of the lung, food pipe, stomach, kidney, uterine cervix, certain leukemias. It's a long list of cancers.
everything can be avoided if only you stay away
Avoided.
from the back.
And in India, it goes to say that out of the 17 lakh new cases in a year, if 40% are linked to cancer, to tobacco, then you can well imagine.
Absolutely. So many deaths can be
Good.
avoided.
Now come to the others. What are the others? The modifiable. I'm only talking of the lifestyles which are modifiable. Tobacco is
Mhm.
one. Shun tobacco. Number two is stay fit, exercise, eat green vegetables, fruits and vegetables, which are seasonal. Don't waste your
Mhm.
money on unseasonal vegetables. WHO is already issued an advisory saying that 20% of the cancers in certain situations, certain groups of people are linked to obesity. So control your body weight. Only if you
Mhm.
exercise, limit your diet, keep a balanced diet, you could control your weight. And controlling the weight not only leads to prevention of cancer, it also makes your blood pressure better. It controls a better diabetic state. It has many other benefits. So 40% tobacco, 20% obesity, 60%
of the cancer is avoidable.
avoidable. Let's not talk of the environmental pollution, others, insecticides, pesticides. They are not modifiable. They are beyond you and me.
True.
But what is within our ambit is, within our scope of action is tobacco, staying fit, taking a healthy diet, balanced diet, and then avoiding the obesity and overweight. I
You
think
know,
it's a very positive message.
we keep on hearing these things, our parents keep on telling us, our doctors keep on telling us, but we just keep on avoiding it. But if bring the numbers to the table, that 60% of cancer could have been avoided, I think that's something that opens up our eyes, that we have to make sure.
Absolutely.
This has
See,
been.
cancers would still continue to happen. Why? Because there are environmental situations, there are dietary situations, and then cancer is a disease of aging process. The population is aging, so there is more opportunity to get cancers. We cannot avoid that. The only way to not to get cancer is not to live long enough. You would cut down the chance of cancer, but that cannot happen.
That cannot happen.
Cannot happen. So what is avoidable is within our means.
That's true. That's very well said. That when 60% of your cancer can be avoided, why would you not make those healthy choices? Thank you very much for that insight. I think it has been brilliant for all of us. And closing this conversation and coming to my last question, one thing that's always in our mind is, what if I get detected with cancer? What if a loved one gets detected with cancer? What are some tips that you would tell the family members and the patient themselves to take care and to stay strong, especially during this time?
I think that's a very pertinent point, that to stay strong, go to the doctor. The oncologist is going to do the relevant tests, stage the cancer, and as per the stage of the disease, there will be a treatment plan. And in today's time, I can assure people around that India has many excellent state-of-the-art world beaters in terms of the cancer centers around. And most of the cities, even in state capitals, even in not even in state capitals, go deeper down into the B and the C cities, there are facilities around. And the message is that no matter what stage of the cancer it is, it's treatable, it's curable still. Early stage curable, the later stages treatable, lot of palliation, making the quality of life better, extending the life. I think these are all achievable goals. Don't lose heart. Go to your doctor. Be science driven. Seek information from the right sources. Don't go to sources which are not authenticated. Your doctors will tell you which websites to access and then where all to seek information. But taking treatment, adhering to the treatment is equally important.
Very well said, sir. I think this point that science, take the route of science, because there are so many people and so many websites which are going to tell you you should do this, you should do that, but ultimately it's the doctor that you should trust, and it's the science that you should trust. And
absolutely,
the core message that I understand is to stay strong, because we're in the 21st century. The medical technology has evolved so much that cancers are treatable, they are curable, and especially if you look out for those early signs. You never know, your cancer can be completely gone and you can live a healthy life.
Absolutely.
Thank you so much, Dr. Vaid. It has been brilliant talking to you. And on this World Cancer Day, this is the only message I would like to give all my viewers, that do not ignore when your doctor says that eat a healthy, balanced diet, exercise right, and stay away from tobacco, because it can significantly reduce your chances of cancer. And even if you do get detected of cancer, or your family member gets detected, it's important to stay strong, and together we can beat cancer. Thank you so much, Dr. Vaid, for joining us. And
thank you so much. My pleasure. Thank you so much.
Thank you, sir.